So to move on now, we need to look at 2.25, where we consider the theoretical foundations of public health interventions. And Howard actually mentions quite some pointers here, and he says that, look, what will happen is that we need to look at the strategies that are employed by the health experts in order to mitigate an outbreak or at least the presence of a disease of some sort. So we need to have a mechanism that we can use. And the first thing that he mentioned was reduce the duration of infection using antivirals. So this is something that we know that if we use antivirals, we are actually able to reduce the duration of infection. So can you see that there is a relationship between the mathematics and the practical aspect to say, look, if we introduce antivirals, then the infection will not stay long in the population. So that is what we are talking about here. Then the second thing that he suggests is try to reduce the contact rate kappa or K. So the small letter K, that small letter K, try to reduce that contact rate. And how do you do that? During COVID-19, we had serious pandemic, we had serious lockdowns. So one of the things is to make people stay at home or skip school if there is a flu, or don't go to work if there is a flu. So these are practical things that we live with every day. This is self-isolation that we are talking about now. And that means if we do that, K becomes small. And if K is small, RE is small. And if RE is small, it means we can manage the disease. All right. And also, we can talk about vaccination. So, vaccination, the way it works now is it reduces the number of susceptibles. So, the people that become susceptible to infection, it becomes less. The number of people becomes less because people are vaccinated. That's why during COVID-19, it was essential that everybody gets vaccinated. Be it people were believing in it or they were not believing in it. Certain institutions actually ended up having mandatory vaccination programs taking place before you can access your office for the protection of the greater multitude. And in some instances, you can have the hygienic practices like wearing of masks, so you distribute face masks or washing your hands, and you reduce transmissibility tau or that T. You reduce it by just practicing good health. So those are the things that we need to put into consideration. And they look theoretical, but they're actually practical because they can be linked to the model. So that is one part of mathematical modeling whereby you actually have to be able to say, okay, after everything has been said and done, how is this a solution to the problem that we've got at hand? So this is part of the public health interventions that were proposed by Howard, and we saw some of them during the COVID-19 pandemic. So the next thing that we are going to discuss in the next video, we'll be talking about herd immunity. There is power in numbers.